Namaskaram. I am Dr. Sanjeev Singh Yadav, a general surgeon by degree, but from the past 2-3 decades, I am practicing a very different specialty, which is concerned with our motion going, that is called as anal canal. Proctology, ఒక ఆర్ట్ అండ్ సైన్స్ ఆఫ్ డీలింగ్ విత్ యానల్ కెనాల్, రెక్టమ్ కింద ఉన్న భాగము, దట్ ఈస్ కాల్డ్ as anal canal. ఇందులో we did not have any special clinics till now. In our hospital at Maven Medical Center, basically a daycare center, we have two features. One is proctology and other is interventional radiology. There are two features in our hospital as a daycare procedure. In proctology, there are many problems associated with anal canal disease, and many people are shy to come forward to tell what this problem is, and they go to many unwanted people who treat them with tying threads or some acid or some material, some tree medicine. Everything has been tried in the anal canal. We are a specialty center where we deal with anal canal in a scientific manner. The problems of anal canal are, number one, as everybody knows, piles. Number two is fissure. Number three is fistula. And associated with that, pilonidal sinus. The last part of the intestine will have in the skin you will have a small opening through which hair, pus, blood, everything will come out. Sometimes it is connected with the anal canal also. So these are the four problems. And in this area, the problems are, you can get a pus cavity which can burst open and always discharge some pus. That could be a fistula most probably. The only way to find out is to get an investigation done. In my center, as a specialty for proctology, we investigate the patient after knowing the history, and then we have a proctocam through which we show to the patient on the screen what is the disease he is having. Piles are a problematic issue to all human beings, mostly because of the diet. We have got a change now. We were Indian diet, now we have gone to Western diet. Western diet has lot of material which we call as junk food, which is not suitable to the Indian intestine. They don't get digested properly. The habits have changed. Number two, the other habit is, with the advent of IT sector, we are doing very well, but the problem is sleeping the whole day, working the whole night. That has become an issue for most of our younger generation. They try to eat whatever is available to them in the middle of the night. The normal standard Indian food is not available in the middle of the night. That creates a problem with the digestive issue, and the patient can develop piles-like symptoms wherein normal anal cushions slide down. There are 4 grades in that, grade 1, 2, 3, 4. 3 and 4 are the dangerous situation where you will get some discharge, where you will get some blood, where you get some swelling coming out and then going in. Ultimately, the whole swelling comes out. Earlier, the traditional way of treating these things was cutting and removing. Nowadays, with the advent of Doppler-guided Hall-Rahr machine, with the advent of ultrasound machine, with the advent of laser machines, with the advent of microwave machines, we have been doing surgeries for more than 2 decades, almost more than 20 to 30,000 patients we have operated. The least complication, relief is very fast. The patient goes back home the same day in the evening, 1 or 2 days rest because of the anesthesia what we are giving. Slight problems like bleeding can come to some patient. Otherwise, basically daycare procedure, the way you come walking, you go back home walking, and the patient is back to work in 2 days. Some people may take some time. It all depends on body to body. Some people response to pain is very low. Some people response to pain is very high. So depending on that. The second issue is fissures. Fissures are cut-like thing which are there at the end of the anal canal. They start from inside and come out. Mostly we see these patients in pregnant women, ladies who have got hard stools, constipation. Because of hormonal action also, the stool can become hard. Food also is one of the most important thing. Most of the fissures we treat medically. But when it becomes a big wound, when it is bleeding a lot, when the whole motion door, which we call as a sphincter, becomes very tight, then in those cases, the patient, after medication, if he is not well, then we have to relax the sphincter, which is called as sphincterotomy. Earlier, the whole procedure was cutting a big cutting and picking up the sphincter. Now, with the advent of laser, a small hole, a pinhole surgery is done, wherein the patient goes back by evening and the same day he can pass toilet without any issue. These symptoms will abate. Some people may take some more time, but most of the time, 90% of my patients go back to work the same day or the next day, depending on the situation. The third most important problematic thing is the fistula. Fistula is nothing but a connection from the intestine to the outside, or within the intestine through the anal canal to the outside. In this, you will be getting a swelling which will burst open, pus will come, blood will come. It might not come continuously. For some people, it might take months to come. For some people, regular. It all depends on the length of the tract. This tract can only be found out through doing a MRI anal canal. And if the patient has a tract, then this tract has to be removed. Cutting this fistula will cause damage to the sphincter muscle, that is the muscles which control your motion. You might get motion without your knowledge. So with laser, advent of laser, this fistula treatment has become a very easy treatment, and the patient goes back home the same day as in all the other three cases. He recovers faster, but the fistula tract, which we do laser ablation after closing the internal opening, might take around 3 to 7 weeks or 10 weeks to get better. So you have to be on continuous follow-up, see the doctor whenever you have a problem, and these treatments can be given. Nowadays, we are doing these procedures as daycare. Patient comes in the morning, goes back home by evening, and the results are very excellent. Recurrence rate depends on multiple factors. Patient not taking care of hygiene properly, constipation not being corrected, eating food which are not allowed. Number 4, most commonest thing what the patient don't come for regular follow-ups. These are the reasons, and patients are having diabetes and thyroid. The intestine movements of these patients get slow. That is the reason why you have to treat those conditions also. Diabetes has to be controlled with medications, whether tablets or injections, depending on your fasting, post-lunch and HbA1c result. Thyroid, ultimately you have to control with tablets only. With this advent, the treatment becomes very, very easy, and the patient is more comfortable because we are not cutting major thing. Sometimes if the fistula is complex, there are multiple holes, we may have to do a combination surgery or hybrid surgery as we call. With a minimal incision, we make the tract close flush to the intestine. You might be having more pain, but ultimately at the end of the day, the damage to the sphincter muscle or the controlling muscle of your motion is not there. That way it is sphincter saving surgery. That way the patient goes home faster and becomes much more comfortable. Recurrence might come to some patients. In that case, we wait for a period of 4 to 6 months and then repeat an MRI. If it is necessary, a second surgery can be done. Sometimes fibrosis means thickening of the tract can occur. That doesn't mean that the fistula is there. If the tract is fibrous, there is no place to enter. That means your surgery is perfect. Unless the discharge comes regularly, we don't need to intervene for the second time. 93 to 95% of the patients go back without an issue. Some patients for which problems are there, we deal that. Obesity is one other factor where fistula recurrence can be there because there is a lot of fat there. Fat can have some pus collection here and there that has to be treated. Even the antibiotics which we give is only after doing the pus culture sensitivity, knowing what antibiotic is good for the body, then only we give. This is the way we treat. Pilonidal sinus, as I told you, it is a tract which is there at the end of the spine. Sometimes it gets connected. It may have pus, it may have hairs. The hair, whether it goes from outside to inside or it is coming from inside to outside, the whole tract used to be opened in a big manner. Now with laser, we open the tract and with a camera we see whatever the contents are there, we remove the contents and do laser procedure. The patients are doing excellently well with this procedure. There is no need of regular dressing. There is no need to visit the doctor many times. So these are the advantages of doing high-tech surgery, or you call innovative surgery, through best machines available in the market. India is producing these machines nowadays. We don't need to buy it from Germany or Europe as it was done earlier. And these machines are giving excellent results. Ultimately, experience of the doctor who is doing the procedure is also important. More the procedure you do, more the experience you get, modifications can happen and the results can be excellent. The way to tackle the procedure is to find out what is the cause. I will show you a picture here. You have hemorrhoids coming down. There is a blood supply or plexus of blood vessels available here. If you don't stop this, hemorrhoids can recur. So the technique is to do scientific surgeries. So scientifically, if you remove these issues, the recurrence rate is very, very low. Problem is to tackle the disease in a scientific manner. Even the fistula has to be closed from inside, and the tract has to be dissolved by laser. So the technique is totally changed. The results are very good. Recurrence rates are very low. So this is what is Maven Medical Center, road number 2, Banjara Hills. You can visit us anytime you want. If you have any issues, if there is a necessity only, we do the procedure. Otherwise, patient can be managed with medical care. This is for the information of people who are watching this video. Thank you.